Nurses across UW Health System are threatening to strike next month for at least 3 days. It is a big escalation in a push to unionize, one that started almost 3 years ago.
Staff retention, patient care, quality are the core concerns the nurses have, and they want their union recognized with no retaliation for employees who participate. Naomi Coles joins us live from outside UW Hospital in Madison. What have we heard from leadership there at UW Health today, Naomi?
Yeah, Eric, in a nutshell, leadership is not budging. They said in a statement today that they're now planning for that threatened strike to happen. I was talking to nurses today. They tell me they want to be acknowledged, and unless that happens, they will be striking. And at the core of all this, it's a legal battle that's a little bit complex.
Nurses are coming in by the hundreds to get involved.
Sherry Signer helped forge this path toward unionization nearly 3 years ago. From 5 or 6 to hundreds strong.
I'd like the board to know that they need to question why Dr. Alan Kaplan is not listening to his nurses and why he is not willing to meet with us when we are all saying, hundreds of us are saying something is wrong.
A vote last night set dates in September for a 3-day or longer strike. Sherry says they're withholding the total number of nurses, so the hospital has to hire replacements for everyone.
And I would assume around that time that they will start to try to move patients out of the hospital. But it will 100% disrupt patient care, and definitely it will impact the patients.
My dad is a teacher, and so I saw the negative impact of that union busting law, Act 10, back in 2011.
Family history and watching UW's decision-making during the pandemic made it easy for Justin Giebel to sign on to the movement.
Anytime that nurses are saying things aren't right and we're stepping away from the bedside because it's so bad, that's where we belong, and that's where we all want to be. But if it gets that bad, you know something is really wrong.
Act 10 stripped bargaining rights from public employees, but UW Health's status is complex. Legal members have offered differing opinions, and Attorney General Josh Kaul said this summer he believed it would be legal. But UW Health's position is that recognizing the union would violate the law.
If he says that we can have this union voluntarily recognized, that we need to go with that opinion.
In a statement, UW leadership made clear they would not come to the bargaining table, saying nurses could avoid a strike by petitioning the state of Wisconsin instead for union recognition. They wrote, quote, "We must take them at their word that a strike will happen."
You know, I guess my question for them is, what do you have to lose? If you respect us the way that you say you do.
As mentioned, UW Health, they don't know the number of nurses striking. For context, they have about 3,600 nurses in all. Nurses actually told me other unions, people who contract with the hospital, like electricians and plumbers, they won't be crossing the picket line either if we get to this place of a strike. All of this is setting up a showdown with the potential for some major patient disruption in 20 days.